Don't forget, you can reach the latest episode of Potomac Watch anytime. Just ask your smart speaker, play the Opinion Potomac Watch podcast.
From the opinion pages of the Wall Street Journal, this is Potomac Watch.
Welcome back. I grant that there are problems in the U.S. healthcare system, but I also don't know that this line from Elizabeth Warren is describing those problems accurately. And I would point first to a Kaiser Family Foundation survey in 2023. It asks people, are they satisfied? How would they rate their health insurance? Total insured adults in 2023, 35% say excellent, 46% say good, 16% say fair, 3% say poor. So pretty good ratings there for people's own plans when they're asked, how do you rate your own insurance coverage? A little bit less positive if you sort that by people who say that they have fair or poor health. Those people, 35% say fair and 5% say poor, but still a majority of those people with health concerns are still saying that they think their own insurer is doing a pretty good job or an excellent job. And Monet, on the point about corporate greed, I think part of the problem in the healthcare industry in the United States is a complete lack of economic incentives and decision making. And everybody who has insurance or interacts with the healthcare industry in any way probably has their own story. But you can call up, if you're in the market for a service, allergy shots, let's say, you can call up 5 or 6 different providers and say, how much are you going to charge me for this? And the answer that I've found that you get is, we have no idea. We can't tell you the answer to that. We can't run it through your insurance policy. It all depends. You have to get the service first, and then we'll bill your insurance, and then we'll send you a bill eventually. And then at that point, you can find out what it costs. And the result of that is there's no economic decision making in this area of life at all, which is completely at odds with how most other markets that people use every day work.
Oh, you're right. And there are a whole bunch of different problems, real and alleged, about the healthcare industry. And I think it's helpful to try to pick them apart and put them in different categories to get a sense of what the most valid complaints are and some of the ones that are massively overblown by Elizabeth Warren and her ilk. So the ones that we can all concede are the difficulty of interacting with the healthcare process. As you mentioned, trying to get any clarity about what's covered on your plan, trying to get any sense of what the cost to you and to your insurer will be for different types of treatment is extremely obscure. And that definitely is an area where both the medical providers and the insurers should be collaborating on ways to create some clarity, which particularly for the insurers, should be in their interest to make it possible for customers to have a sense of what treatments are going to cost them, to be able to weigh their options and potentially go down a course which is going to be less costly, is something that insurers should really, really be leaning into and doing a better job of giving good incentives to their policyholders. You then have the question of the overall cost. And there's no doubt that premiums that ordinary Americans pay for their employer-sponsored coverage can be extremely high, and that can also be matched with very high deductibles before you're getting to the point where you're actually getting coverage for the treatments you're seeking. And I think that that is a big problem, but it definitely is one that is not created by the health insurers on the whole. It's created by the bad incentives that a lot of the medical providers face and their ability to inflate the costs of these treatments, often steering people towards unnecessary treatments. And that is an area that it's absolutely ripe for reform. And I think that policymakers have really struggled to address in the past. Then there's the problem of supposedly denied claims for a lot of necessary treatments. The idea that these insurers are constantly denying coverage to people who are in dire need of it, who have all of the symptoms and all of the signs that they should be getting key life-saving treatments or life-improving treatments, and that you have bean-counting insurance execs who are coming up with completely unjustified rationale for denying claims. And there really is no evidence of that. If you look at different types of insurance, from auto insurance to flood insurance to title claims, all of these different types of insurance coverage that people get, health insurance is one of the fields where the largest amount of revenue that's coming into the insurers is actually being paid out in claims. And so that is a sign that you don't have proportionally a large amount of people who are in need need of coverage who are being denied. Of course, it depends on the type of treatment they're seeking, if it's experimental, if they're getting toward the end of their life and things of that nature. You're going to have difficult cases where people are going to be denied. And I think a lot of people probably know someone, a friend, family member who wasn't able to get coverage for a treatment that they wanted. But looking objectively in the aggregate, the idea that these insurers are regularly denying necessary claims just isn't really true. And so I think that you have to be able to pick apart the different problems in the health insurance industry and not just go along with people who are saying that these companies are greatly at fault for things that there isn't really evidence of the problems that a lot of these critics are alleging.
And the point, Bill, is that these insurers, I don't think, are denying claims because they are bad people who are trying to take more money for themselves. They're denying claims because the money has to come from somewhere. So there are situations where this is covered by your plan and this is not covered by your plan, or this medicine used to be covered by your plan, but now there's a new generic that has come on the market, and studies show that that works about as well. And so we're going to ask you to move from this medicine to that medicine. Another factor is that there are all these government interventions that are creating cross subsidies that make it more confusing, more complicated, more opaque. Medicare and Medicaid cover about a third of Americans, and they pay doctors and hospitals at below the cost of providing care. So then all of that gets made up by private payers, private insurers who are paying above the cost of care in order to make everything net out. And I would add Obamacare, which I think has only added to this problem and created more of these cross subsidies and complications.
Yeah, I agree entirely. You know, the way I look at it, I'm at the age I see a lot of doctors. I had a stroke 3 years ago, so that complicates things. I see a lot of doctors. I too get frustrated by the system. When I look at the problems, Monet was talking about the categories. Most of the problems I see in healthcare, from my point of view, as someone who uses a lot of it now, is created by the government bureaucracy. And I just imagine what it would be like if we relied on the government, if it had that much input into the smartphone market. You know, the smartphone market is very competitive, and they want your business, and they advertise whether it's different monthly rates or the better phone and so forth. It's very competitive. I don't think many people have the complaint there. They can go out and pick from a lot of different choices they have. And government, by contrast, is very heavily into the healthcare industry. And we have the HIPAA laws about privacy that hinder sharing information and so forth. And again, I lived in Hong Kong about 20, 30 years ago, and the healthcare system was first world, excellent. And when we had our first child, we were at the doctor often, and so much was paid for out of pocket. I think when people hear the market and they hear words like corporate greed, they think only the government is keeping the lid on prices. That is not true. We paid a very reasonable amount. I would much rather have the system we had then than the system we have now. And I think, you know, it goes back to competition and transparency. And the government has made that much more difficult in the healthcare sector. And the irony of all these critics that think the shooter had a point, most of them, their solution be let the government take over healthcare.
And there are examples not far from the U.S. where you can look about how that has worked in practice. Here is one that I've seen from March 2024. Headline from the Canadian Broadcasting Service, the CBC: hundreds line up outside Kingston Clinic in desperate bid for family doctor. It says there was a new practice that was announcing 4 physicians would take on as many as 4,000 new patients. The clinic, some 30,000 residents are without a family doctor in Kingston. Here's a line. On Wednesday, the line was cut off at the first 100 people. Kate Aldred's husband arrived at 5:30 a.m. Wednesday and was 95th in line, but didn't get his turn until 3 p.m. Here's a quote from her. He decided he was okay with waiting 10 hours in the rain because it was going to save him all of the future waiting times that we would have as a family, walk-in clinics, urgent clinics, wherever we needed to go for care. They moved to Kingston in 2020. Their youngest daughter, who was 4 at the time, had not seen a doctor since she was 6 months old. And there's similar stories, Monet, from the National Health Service in Britain, the rationing of care there. And that's because, again, the money has to come come from somewhere. And when government is allocating the money, setting prices, putting prohibitive caps on how much doctors can earn or drug makers can charge, the result is you end up with lines and waiting lists and so forth. It's basic Econ 101.
Well, right. And I think that a lot of Americans would be shocked if they look at the salaries that a lot of doctors in places like Canada, in the UK earn compared with the salaries that doctors and other medical providers earn in the United States. There is a big depression in the way that medical professionals are compensated in countries that have heavily managed care, that have a lot of government intervention in the ways that the provision of medical care is priced. And that reduces the amount that these providers can be compensated, and you end up with a lot fewer of them. And so in the United States, one of the upsides of our healthcare system is that people are able to get in for treatments, particularly specialty care, because we have great incentives for a lot of people to become orthopedic surgeons, become ophthalmologists, and be well compensated for the amount of learning that they have to do to be able to attain those positions. In places that have different incentives, you have many fewer of them. And one of the downsides of that is these types of long waits, long lines, many more denials in terms of your ability to get seen at all for any kind of elective treatment. And so there are trade-offs in the system. And I think that if you are going to try to bring down the price of care, you have to be careful about how you do it. Are you doing it in a way that's promoting more competition in the way that Bill said, a free market approach? Or are you doing it by mandates that reduce the price of care? If you do it the second way, that's going to affect the availability in a way that I think would shock and disappoint a lot of people in the United States who have insurance coverage today.
Thank you, Monet and Bill. Thank you all for listening. You can email us at pwpodcast@wsj.com. If you like the show, please hit that subscribe button, and we'll be back tomorrow with another edition of Potomac Watch.